there, and welcome to this conference hosted by MS Focus, the Multiple Sclerosis Foundation. I'm your host, Deborah Foreman, the Educational Programs Coordinator for MS Focus, and I'm joined by Cherie Binns, who's here today to answer all your MS-related questions. Now I'd like to introduce her. Cherie Binns is a registered nurse with an additional degree in gerontology and is also an internationally certified MS certified sclerosis nurse. She's our patient healthcare liaison, a writer for MS Focus magazine, and a regular presenter of patient educational programs for the Multiple Sclerosis Foundation. Cherie was diagnosed with relapsing remitting MS in 1994 and has found that adapting changes in her lifestyle has made her MS much easier to manage. We're pleased to have her join us today. Cherie, thank you for being with us. And I'm going to turn it over to you as soon as I tell everyone how to submit their questions, okay? So if you have a question or comment, you can ask it using the Q&A button in the app, which also allows you to send your question anonymously if you choose. You can also ask your question live by raising your hand, and to do so, just click the raise hand button or press *9 if you're on the phone. I'll call on you, and then you can just unmute yourself and ask your question. So Cherie, let's see what's going on. Let's see if we have any questions in our chat yet. I think this is new.
I don't see any questions in either the chat or the Q&A. I think Bhavya is watching to see if there are any coming in on Facebook Live.
So I can ask you one of the questions we were discussing. I'd like to hear your answer on that. So when we talk about steroids, as far as managing symptoms, can you talk about that a little bit? Because I'm sure a lot of people are interested in that.
Sure. Steroids played a really large role in management of MS symptoms and shortening relapse severity and length of time before we had drugs available to treat and manage our MS. As drugs have become more effective over the years, it's rare that we should ever need steroids after maybe that initial episode that really knocks some people down and out. Steroids are not benign. They really bring with them some long-term, potentially devastating side effects. If, for example, you've gotten 2 or 3 doses of high-dose steroids over, say, a 1-year period. So you're getting a dose of 1,000 milligrams of IV Solumedrol, or maybe 1,250 milligrams of oral prednisone per day for 3 to 5 days. You get 2 or 3 of those in a year, and you begin to set the stage for things like obesity that is almost impossible to overcome. It just resets the metabolism. Bone thinning, which can cause fractures 2 or 3 years, even 4 years down the road after that. It tips many people into type 2 diabetes, and it can also impact our thyroid. So there's a lot of things that people don't realize are potential side effects of those steroids. They just know that they feel better faster. Most relapses will resolve without steroids, so you might want to consider it if you've lost complete vision in an eye, for example. It doesn't improve the ultimate outcome, but it might get you some usable vision a little bit more quickly. If you are completely paralyzed from the waist down with a relapse, you may need some steroids. So it's a conversation to have with your doctors, but I would be very hesitant to encourage anybody to ask for steroids. The big thing is to really have that conversation with your doctor and get onto a medication, a disease-modifying therapy, as early in the course of the disease as possible to prevent the need for steroids and relapses. I see an anonymous attendee is asking, she says, I was diagnosed with relapsing remitting MS May of 2020. How do I know if I'm in remission? My symptoms are still here from when they first started in April. They've improved slightly, but they're still here. Symptoms that would come and go are now coming more often and staying a lot longer. Am I not in remission yet? You may never go into remission if you don't get onto a disease-modifying therapy. Or you could go into remission and not have another event like that relapse for years, but still have damage going on in the central nervous system if you're not getting onto a disease-modifying therapy. Leslie is saying, I lost 28 pounds in the last 4 months, and I'm concerned about muscle wasting. Other than exercise, is there anything I can do? Thanks. There are many kinds of exercise. I think just purposefully moving can really help you get over that hump and keep those muscles in tone. You don't need to be doing bench presses or weightlifting or anything like that, but you do need to be moving. High protein diets are also very helpful in maintaining muscle mass. You need protein, whether it's from a plant-based protein or an animal protein. You do need protein to take care of that. Have you seen COVID? This is another anonymous attendee. Have you seen COVID affect MS? I tested positive on October 24th, and I've had so many MS symptoms ever since. Yes, I have. I know that my vision is a little bit worse since my second dose of COVID, case of COVID. I had COVID back in February of 2020, before we shut down. And those symptoms lasted for a good month and then began to gradually relax. But in August, I got COVID again, and my vision was problematic from that point on. I was driving less because I just didn't trust my vision as well. And then I just got COVID again before Christmas. So fortunately, that's beginning to get better. I would say, again, I may sound like a broken record, but if you're not on a disease-modifying therapy, you're more likely to find long-term ramifications, impact on your MS from the virus. What about low-dose prednisone? This is from Ryan. What about low-dose prednisone for non-MS medical issues? This is a conversation you have to have with the doctor who's prescribing. I don't recommend steroids to be taken on a regular basis unless it really is necessary. I know a lot of people with arthritis are needing to take some steroids just to manage the pain. It knocks the pain down a bit. Steroids will interfere with the healing process. So if you've got a cut, if you've had surgeries, if you're recovering from a non-inflammatory injury or illness, then steroids are going to slow the healing process potentially with that. So I would say there is no solid answer for that question, Ryan. That's a conversation you need to have with your doctor.
Cherie,
Yeah.
excuse me, but Taylor from Facebook is asking, why is it so hard for doctors to diagnose systemic sclerosis?
Systemic sclerosis is not multiple sclerosis. I can't answer that question. Okay. Now we have James saying, I've been seeing a neuro since I was diagnosed back in 2018. Would there be a good reason to try to see a specialist? I have primary progressive MS, and even though it would be a drive, should I? I'm happy with my current doctor and just wondering if she has all the tools. Maybe just a one-time consultation. A one-time consultation with an MS specialist is always a good thing. If you don't have an MS clinic or MS specialist near you, I would strongly advise, if you have the resources, to make the trip and get that second opinion, those fresh eyes on, particularly if you're seeing a general neurologist and not one who has 500 to 1,000 people with MS in their practice. They may not be keeping up on current literature on things that are going on in the treatment arena. So yeah, I would go ahead and get that second opinion, and they can converse with your neurologist that you like and that's continuing to treat you, and perhaps the two can develop a relationship where they can consult on what you need.
Yeah.
Elsie, I'm sorry, Elsie says, can you address supplements? Who can you consult regarding vitamins and supplements? The only supplement that the Consortium of Multiple Sclerosis Centers is currently recommending for everyone who's living with MS is vitamin D. And the dose that you take is going to be dependent on your vitamin D levels. We want to see our vitamin D levels being between 50 and 70 generally. And most of us without supplements are going to be down in the 15 to 20, even 30 range. 30, 32 is about what most labs list as low normal. We tend to do better, have fewer relapses if our levels are kept between 50 and 70. So you should be having vitamin D levels drawn at least a couple of times a year, and change your vitamin D dosage based on that and what your doctor recommends. I know that most doctors will start people at about 2,000 units per day. I found that in order to keep my levels in that range, that I need to be taking about 5,000 a day. But during the winter, when I'm indoors more, I do need to take sometimes an extra dose or two a week on the advice of my neurologist.
Cherie, excuse me, is there a type of healthcare professional that you would encourage them to see regarding that if it wasn't going to be their regular primary?
No, the training is so inconsistent at this point in time, and most healthcare professionals that say that they are experts in nutrition also sell nutritional supplements online and from their office. So it's a second source of income for them. I would say no. Vitamin B levels or B12 levels are another thing that may impact neurological symptoms. If you have low levels of vitamin B12, you may have more neuropathies. So that may be something your doctor might want to check on a regular basis. We tend not to absorb B12 from our foods. And the foods that are rich in B12 are usually organ meats. They're all of the foods that are rich in B12 are animal sourced. So you may need to take a supplement either sublingually, where it's absorbed into the circulatory system in the very high vein circulatory area under the tongue, or you may be needing to get injections of B12. Anonymous attendee, I'm gonna, let's see, I posted the first question about remission. I'm on Kesimpta, started it last July. Okay. Most of the medications that are B cell depletion medications like Kesimpta or Ocrevus or Rituxan, Truxima, and the new one that was just approved by the FDA, Briumvi, last week. Most of those medications take a good year to really sort of modulate the immune system to the point where we're not having relapses. So you need to give those drugs a while, but boy, I'll tell you, if you can ride it out for them to really kick in, it's a very, very effective form of treatment. And you may never find that you're having another relapse after this one. Anonymous attendee, how can I find a doctor specifically for MS to help me get a diagnosis? The Consortium of Multiple Sclerosis Centers has a list of doctors that specialize in treatment and diagnosis of MS, as does the National MS Society. They have a whole website that's designed to highlight who in what areas is doing that. So I'm going to ask Bhavya if she wouldn't mind looking up the address for the physician locator for the MS Society and put that into the chat. Let's see. Bridget is asking, can acute insomnia that comes on seemingly very suddenly be MS related? Are there any ways to address it without the use of prescription drugs? Good question, Bridget. People with MS have a far higher rate of sleep disorders than do the general population. So you're probably, if you're already noticing this, want to talk to either your primary care physician or your neurologist about getting a sleep study done. And I would go ahead and get that taken care of. There are ways to address insomnia, things like sleep hygiene. Use your bed for sleep or sex only, not for television or reading or studying or anything like that. You want your mind to turn off when you get into bed. You want it to be a place of relaxation. Keeping your room as dark and as quiet as possible, keeping it cool. The cooler your room, the better sleep quality most people generally experience, whether or not they're cool sensitive. You can always pile the blankets on or use an electric blanket if needed, but breathing in the cool air seems to help people sleep better. So there are ways to address it without drugs. Elsie asks, can you discuss whether there's a relationship between MS and Lyme disease? Those two diseases tend to mimic each other, which is one of the reasons why it often takes so long to get a diagnosis for MS. They need to rule out things like Lyme disease first. There are blood tests that will do that. Sometimes we'll even see when you have a spinal tap to help diagnose MS. Sometimes if you've got a savvy physician ordering these tests, they'll also look for the spirochete for Lyme in the spinal fluid. And we know if we see that, then you definitely got neurological symptoms from Lyme disease. So there's no relationship between the two, but MS has been mistaken for Lyme disease. And Lyme disease has been mistaken for MS. So you want to really ferret that out. Let's see, Bridget's done, Elsie's done. Let's see, Pam, what diet do you feel works best for MS? And the answer officially, as of about a year ago, from the American Academy of Neurology and the Consortium of Multiple Sclerosis Centers, is that there is no one diet that is best for MS. The diets that are generally touted for MS, things like the paleo diet or the Walls protocol or the Mediterranean diet or Swank diet, intermittent fasting, all of those diets have similarities. One is they're all fresh, whole foods. They have no additives, no preservatives. They're not pre-prepared. They are fresh, whole, real food. And so if you can just eliminate things in your diet that have ingredients that you can't pronounce, ingredients that you don't recognize, and just eat fresh, whole foods. Since I did that, I have found that I can have a meal put together cooking from scratch in most cases in less than half an hour with maybe 5 or 10 minutes worth of prep time. So it's not difficult to do that. All right, so Pam, let's see. Anonymous attendee asks, what disease modifying therapy do you feel is most beneficial? I'm considering Kesimpta, but I'm worried about infection risks. I think sometimes we can get really hung up in the side effects that we're reading online for drugs. If more than 1% of people in clinical trials are having a side effect, they have to print it in the literature. And I have to say that the drugs that I've been on that have advertised or said that there are high side effect risks, particularly infection risks, those that announce the highest infection risks are the ones that I have had the least problem with. So this is really a conversation you should have with your prescriber. If they're not an MS certified specialist, they may be recommending something from a very limited choice because they haven't gotten really well educated on all that's available. So really, go in with 3 or 4 drugs that you might want to consider taking and ask them to give you the pros and cons of those drugs. So don't second guess. I haven't heard too many people on Kesimpta getting infections. Infections with other B cell depleters, which are some of the more effective disease modifying therapies, are generally urinary tract infections or upper respiratory infections. So, but not so much that I would tip the scales if you've got an active form of MS that really needs to be addressed. Margie says, what did she say slows the healing process? I had a hard time getting in. Steroids. You want to avoid steroids whenever possible because steroids slow the healing process. If you have an injury, if you've broken a bone or sprained something, steroids will often slow that healing process because they reduce inflammation, and inflammation is key to healing. When inflammation arises in our body, it produces more white blood cells, and those white blood cells are our infection fighters. And steroids knock down our ability to produce them. Let's see, Andrea, my physical therapist has never heard of UTOF's effects. He made a comment about building a tolerance to heat, similar to how you should build strength in muscles. Is this possible? And can I become less affected by the heat if I work at it? No, and get away from that physical therapist as quickly as you can. Physical therapists who still believe that way are not trained to work with people who have MS. It is recommended if you have UTOF's effects or resumption or worsening of your MS symptoms as you exercise or get overheated, that you wear cooling equipment, such as a vest or a cooling collar or wrist or ankle wraps while you're exercising, that you pre-cool for about 10 to 15 minutes prior to embarking on exercise. So there is information out there that's available on that. And we do have some at msfocus.org. If you go to our educational materials, you'll find some information on that. Let's see. Tiffany, I started Kesimpta last year. Are there any blood tests that need to be done regularly while taking this DMT? My neuro didn't mention it, and I didn't ask before starting. This drug doesn't have anything directly. You probably want to have, since it is a B cell depletion, excuse me, medication, it may affect your the white blood cells and the types of white blood cells that are in your blood at any one time. So I would say after 6 months to a year, your physician may want to be ordering an annual lymphocyte subset test that will tell them what it's looking like for your C your T and B cells, particularly CD19 and 20. There are blood tests that you can get that look at that specifically. So your individual prescriber may want to do that. I see Ryan has a question here, but he's already been answered once. So let's get on to some of the people who haven't had questions answered. And Ryan, we will get back to you, I promise. An anonymous attendee says that they're getting Evusheld on Monday. I have heard I should vaccine after that. I'm on Ocrevus. All right, there are 3 different questions here. Evusheld, as of 3 weeks ago, was there was a statement issued by the CDC stating that the current strains of COVID that are out there are no longer responsive to the antibodies that are given with Evusheld. And the only people that should be receiving Evusheld at this point are those who have no antibodies whatsoever because they are severely immunocompromised, or those who, for one reason or another, are unable to get a COVID vaccine. So you may want to revisit that Evusheld question with your prescriber, since there is new recommendation on that as of just 3 weeks ago, before Christmas. The other thing is, I have heard I should vaccinate after that. The vaccine and the Evusheld do not have any link whatsoever time-wise. So you can get them at the same time. You can get them at different intervals. Your big thing here is that you're on Ocrevus. If you're getting a vaccine, you should try to time your vaccine dose so that it's at least a month before your Ocrevus infusion. Time it so that it's as close to the upcoming infusion as possible and not too close to the last infusion. Our Ocrevus infusions are making it less likely that we will have a good vaccine response to a good immunoresponse to the vaccine. The longer we're on these B-cell depletion medicines like Ocrevus or Rituxan, the less likely we are to develop a really robust response to the vaccine. Those of us who are on this category of medication and have been on it for longer than, say, 18 months, probably need to be masking every time we are out in public, because we just need that help. We just had one pop in from Facebook. Dominique asks, what age is most common to get MS? I'm 36. I was just wondering. Also, do stress and anxiety play a factor in MS? MS historically is diagnosed between the ages of 20 and 40 most often. That said, we have about 30,000 children in the United States who've been diagnosed with MS. So we're talking children as young as 5. We also have people who are being diagnosed into their 50s or 60s. So it can be diagnosed at any point in time. And yes, stress and anxiety are major triggers for symptoms that may be related to MS. Margie, what helps with leg cramps? Stretching used to help more. And so my guess is that it said strong, S-T-R-O-N, and then I see she's typed in later strong leg cramps. Leg cramps are most generally associated not just with MS or with neurological problems, but with dehydration. Those of you who are getting a lot of leg cramps and are hydrating more, an extra couple of glasses of liquid a day, are going to find that you're going to see those cramps less strong. If they have a neurological component, they still may happen, but you may not get the severity if you're well hydrated. Jill says, back to steroids, please. I've been hospitalized twice in the last 6 months for pseudo-relapses. I've received IV steroids both times and been sent home with a taper. I get complete loss of bladder control, extreme leg weakness, and lose most all strength in my left hand. What other options do I have besides steroids? I've been diagnosed 13 years and I'm on Mavenclad and raising my 4-year-old granddaughter by myself. A pseudo-relapse is not treated with steroids. So your question is somewhat confusing. I wonder if maybe whoever is giving you the steroids doesn't really know that it's not a relapse. I wonder if you have had an MRI recently to show that maybe there is some new activity. As far as alternatives to steroids, Mavenclad is a pretty good high efficacy drug that is not having to be taken. It's taken just for a few days, 1 year, and again the next year. And then generally you don't need any more after that. If you have a very aggressive form of MS, you know, that's a conversation you need to be having with an MS specialist, not a neurologist. So please seek out an MS specialist. And I do see that Bhavya has put the link to the MS Society Find Doctors link. So you might get some information from that as to somebody who's near you. Let's see. I want to get back to Ryan and not make him wait too long. Is it unheard of to be on prescription strength 50,000 unit vitamin D? No, it's not. And if you're on a prescription strength 50,000 unit vitamin D, that's a once a week prescription. It's generally not a daily prescription. And if you're on that strength, you're going to be monitored regularly. If you're not, you shouldn't be on that strength. So that high a dose prescription vitamin D does need to be monitored regularly. Let's see, Gus, I've been on Plegridy for almost a year. Do you have any suggestions for injection site reactions and redness? Other than rotations, I think being sure that you give your injection in a different site every time. Don't go back to that same site. Now, Plegridy's every 2 weeks. So I would not go back to that same site more often than every couple of months. So be sure that you're alternating. I found that I was getting fewer injection site reactions when I was using an injectable medicine when I did them on my abdomen rather than my arms or legs. I was getting more of a reaction on arms and legs than I was on abdomen or even upper hip. I also have found that if you can bring the medication to room temperature, leave it out overnight and bring it to room temperature, you're going to have less of a chance for a real serious side effect. If you're using an auto injector, you may have more side effects than if you're injecting at a consistent slower rate. So those things all may help. Another anonymous attendee, to what level is research being done to discover a cure for MS? I said 15 years ago that I expected to see a cure for MS within the next 10 years. I now don't expect to see one within the next 25 years. A cure for MS is most likely to come not in myelin repair. We're not seeing that being effective in humans. It is effective in mouse models, but myelin repair has not been effective in humans to this point. So I think what we're going to see is a vaccine being developed, probably using mRNA technology similar to what our COVID vaccines are. And it's going to probably shut off those genes in the immune system that would open us to responding to irritants that might set up something, a reaction that could trigger MS. And so the individuals that would be probably most likely to get it are direct family members of individuals who have MS, because there's a little bit higher rate of MS in bloodline family members. And we'll see what happens from them. I mean, there's a fair number of people in the world at this point, far greater than we thought 5 years ago, who have MS. So those are going to develop over time. As far as somebody who has MS and has had it for years, the cure for MS will not be working for any of us. The best thing that we can do to cure MS is to get on a disease-modifying therapy and get our MS stabilized. Elsie says it was recommended that I try autophagy. What are your thoughts? Elsie, I don't know what that is. I'm sorry. Anonymous attendee, should someone with MS give up on their bodybuilding passion for life? No, no, you want to stick with it. You may need to modify what your expectations are, particularly if you're heat sensitive, or if you find that your working out maybe is too intense for what you're able to tolerate. I think that evolves over time. So no, don't give up. Bodybuilding, any kind of exercise is really very, very helpful to people who have MS. Elsie asks again, what are the best actions to take to help with inflammation? The number one answer is something you're not going to want to hear, and that is eliminate all sugar from your diet. Eliminate all sodas, eliminate all desserts that are not fruit, that don't have anything that has added sugar to it, or even artificial sweeteners are all triggers to inflammation. So you want to get them out of your diet, and it's hard. And it's going to take you probably 4 to 6 weeks of just cold turkey before the cravings stop. But that is the best way to knock down inflammation. Anonymous attendee says, in regards to possible infections when taking a B-cell depleter, DMT, should we avoid going out to restaurants and social things, especially during the winter months when cases are on the rise of COVID, flu, and RSV? I don't want to advise that you avoid. I personally am avoiding. I am not going to restaurants. If I do go to a restaurant, I go at a time that's not busy, not during a dinner hour or lunch hour, but in between. So I find that if I really want a special meal at a restaurant for an anniversary or birthday or something like that, I'll go at 3 or 4 in the afternoon because it's not going to be crowded. I will wear my mask at the table. We talked about this earlier. I will wear my mask at the table if it's at all crowded. And I'll take the mask off and put a mouthful in and put it back on if it's at all crowded. However, I really, we've sort of relied, if I'm eating out, we've sort of relied on doing takeout rather than putting ourselves around a lot of other people. I always wear a mask when I go someplace like church. I'm avoiding going to theaters or anything like that, just because I know that I have no antibodies, even though I've had 3 infections with COVID. I've had 5 doses of vaccine with COVID. I've had 2 rounds of antibodies. And because I've been on a B-cell depleter since 2014, I'm just not mounting that response. That said, that type of medication has been the best medication for me ever. And so I don't want to go back to being scooter dependent. I don't want to go back to being legally blind. I don't want to go back to having to catheterize. So I'm choosing this for myself. You kind of have to weigh those options. Is it more important for me to go out to eat, or is it more important for me to have my MS under control? And just, be smart about it. Let's see, we've got a couple more here. Anonymous attendee. If you have dystonia as a symptom, what part of your brain or spine is there a lesion? Any recommendations for helping dystonia naturally? No recommendations for helping dystonia naturally. And it's not necessarily a specific part of the brain or spine. You can have, generally, if it's in the spine, it's going to be more affecting your extremities. Whereas if it's in the brain, it could be affecting any part of the body, anywhere. But I will say that regarding helping your symptoms, again, your symptoms will be helped by knocking down the inflammation, and that can be done by eliminating sugar. And it can also be done by getting onto a disease-modifying therapy and letting it do its job. Eric, what helps with MS hugs? MS hugs, I've found that my MS hugs, when I've had them, have been more related to heat and dehydration. I can have them for 2 or 3 days at a time, particularly in the summer, and then it just clicks. And I put on a cooling vest, and that will almost certainly relax it for a period of time. I've only gotten an MS hug once during the winter time, and actually a heating pad helped to knock down the spasm in my rib cage and release the hug. I have also found that drinking very, very cold liquid very quickly helps to knock that down. Not so quickly that you get like an ice cream headache or brain freeze, but both cooling and hydration have helped with that. Anonymous attendee said, would a monthly shot of B12 help with MS fatigue? There's mixed thinking on that. My neurologist says he has patients that swear by that. So have that conversation with your doctor and try it and see if it does help. Eric says, I'm 51 and I was just diagnosed in August. They think I've probably had MS for 10 or 12 years. I had my first Tysabri infusion last month. Is this a good medication? It is. It was our first more highly effective medication that came on the market. And there are many people who've taken it for a decade or longer and are doing beautifully on it. So I think it may be a good choice for you with very few side effects. Jacqueline, is it normal for a patient's MS symptoms to worsen after switching from Tysabri to Ocrevus, along with increased blood pressure and pulse? Could symptoms lessen with my second Ocrevus treatment? I already asked the doctor and the manufacturer. Both said they can't because they can't say because everyone is different. I think you've said something here in this with increased blood pressure and pulse. Ocrevus is given generally with a pre-medication of steroid. Usually 100 milligrams of Solu-Cortef or Solumedrol. That can increase your blood pressure and increase your heart rate. And for some people that tend to be sensitive to steroids, that can last for more than a few hours. It can last for a couple or 3 days or even longer. I know with me, when I'm so sensitive to steroids that when I get even a small dose like 100 milligrams, that I will not sleep for a week, even with prescription sleep med. My heart rate won't go below 120 for that entire week. My blood pressure won't go below 200 over 100 for that entire week. So my doctors have just basically said we're not willing to risk a cardiovascular event with steroids. So you may want to have, Jacqueline, that conversation with your doctor and see if I would say after probably your second dose of Ocrevus, if you've had no negative reactions to the Ocrevus per se, what you're describing is steroid related, I'm almost positive, and not Ocrevus related. You may want to have a conversation with them about an alternate pre-medication, something like maybe Benadryl and Tylenol. Okay. Let's see, Jacqueline, we're done. Anonymous attendee. Can high-dose steroids, just the initial one-time course after a first attack, permanently cause high blood pressure? Or would it be a temporary thing where it could go back to normal after the steroids were done? Most likely it's temporary. That said, you may need some blood pressure medication to get your blood pressure back down if it's in a dangerously high range. Some of us are very, very sensitive to steroids. So I would say if you have developed high blood pressure with that first round of steroids, that you should be seen by your primary care at the very least and evaluated for whether or not you need something to help manage the blood pressure.
Cherie,
Yes.
excuse me. I don't know that we answered. I don't remember if we answered Dominique's question from Facebook about.
Yes, we did. We answered that probably 10 questions ago.
Okay, good. Let's see if we have any more. Yeah. If anybody has a question, now is your time to send it over. You gave some really great information, Cherie.
Oh, thank you.
That was awesome.
I did mention earlier as part of the talk about B-cell depletion medications is that at the beginning of this week, or maybe it was 31st of December, I think, the FDA approved another B-cell depletion medication called Briumvi, Briumvi. It's in the same drug category as Ocrevus and Rituxan, except while those drugs are a 3 to 4 hour infusion, this is a 1 hour infusion twice a year. So there's less time that may be needed out of work. For an infusion, you may not need to take a day out of work to get your infusion or a half day. I don't know what the cost of that's going to be. I don't know whether it's covered by your insurances. So those are questions to ask again. Let's see. Gus is asking again, do you know if interferons affect triglycerides? Not generally. The triglycerides are more affected by things like steroids. That steroids just do a number on your triglycerides. Also, triglycerides tend to start elevating if you're getting ready to convert into diabetes. So if your blood sugars are running a little bit high, your triglycerides are more likely to be running high. I had a doctor who was an osteopath several years ago that when my triglycerides started bumping up, I think they were 230 something, and I've never seen them that high. And she said that rather than putting me on a statin to manage the triglycerides, she was more inclined to try something more natural. So she put me on fish oil, and just the fish oil capsules that you get over the counter at the drugstore. Your local pharmacy has their brand with fish oil, things like Nature's Bounty and Nature Made. There's a lot of different. Do not get them at GNC, please. Do not get your supplements at GNC. There have been several things done to look at products coming off their shelves, and there's no consistency. The active ingredients are not as stated on almost every label that they've looked at. So she suggested that I start out at 1,000 milligrams twice a day. I'm now at 2,400 milligrams, and that's keeping it where it needs to be. But she checked the triglycerides a month later, and they were down to 82 just with putting the fish oil in. So you may want to have that conversation with your doctor. If your triglycerides are high, ask if you couldn't potentially take take a trial course of a month or two and have your blood rechecked. Okay. Let's see. Gus. The GP told me the same with omega-3. Your fish oil has a lot of omega-3s in them. So both are very similar, have very similar ways of working. Anonymous says, I have horrible brain fog. So much that I can't think clearly to work or to be in social situations lately. Any advice if antidepressants could help? I've heard that it can help, and my doctor recommended Lexapro. I would hope that if your doctor has recommended Lexapro, that they have done a brief assessment to determine if there is depression that's causing this brain fog. Depression has as one of its side effects brain fog, but you don't want to be treating something for something else. You know, you want to really dig into it and figure out what's causing it. Brain fog is also intensified, and clinical trials have shown this. If you're dehydrated, you need to get your fluid level up, because as you dehydrate, you actually lose brain volume. There's been a couple of clinical trials that have looked at healthy controls, and they're doing MRIs on healthy controls, and then they have them dehydrate for several days. They do another MRI, and they've lost significant brain volume. They have them rehydrate, and their brain volume returns. And they were testing cognitively poorer during that time where they were dehydrated. So you might want to try that. Is there a brand of vitamins that you recommend? Eric asks. No. I would say that whatever brand your pharmacy has, CVS, Walgreens, Rite Aid, those store brands of drugs are generally held to a pretty high standard. Also, as I said, Nature's Bounty and Nature Made are good. Steer clear of your big chains like GNC. Leslie said, can you repeat vitamin D levels needed to help with MS? Also, I recently had vitamin D level done and insurance refused to pay for it, saying it's not needed for MS. That's because they have put the wrong code on it when they have, you have to have vitamin D deficiency as a diagnosis. And almost all people with MS are vitamin D deficient. So they need to put the right code in order to get the insurance to pay for it. Does the number of, this is an anonymous attendee again, does the number of O bands you have indicate the severity of the MS? I had 13. I've heard from some people they were told by their neuro that the higher number of O bands means a more severe, faster progression. We used to think that. That is not the case anymore. You could be in a period of high inflammation, and as a result of that, you have more of the O bands. And the O bands, for people that don't know what they are components of the myelin that has been attacked during an inflammatory process in the brain. And so they kind of slough off and get picked up in the spinal fluid. You could be just in a real active inflammatory stage, and you knock that inflammation down and they go away. So it's not, you know, I've heard a lot of people say that their doctor is insisting, they've changed doctors and the new doctor's insisting on a spinal tap. The spinal tap is showing positive for O bands, maybe in 70% of people that have MS. If you have a disease that's not active right at the moment, you're probably not going to see O bands in the spinal fluid. Another anonymous attendee says, the new drug that was just approved, what does it treat? Or version What version of MS? Primary progressive? No, it is not for primary progressive MS. It is only for relapsing forms of MS. Another anonymous attendee, do you feel that eliminating gluten can help with MS symptoms? It did for me. It helps with MS symptoms if you're sensitive to gluten. And I didn't know that I was sensitive to gluten until I eliminated it for about 3 or 4 weeks and then added it back in. And what I found was that pain increased, my spasticity increased, my vision got worse. I wasn't thinking as clearly. So for me, there were 2 dietary triggers, both dairy and gluten, but I have found that I can consume aged cheeses, which have little or no lactose in them. I can also consume like Greek style plain yogurts without getting those side effects. However, if I have a soft cheese or ice cream or milk or cottage cheese or anything like that, it flares up those symptoms for me. So you may try eliminating gluten or try eliminating dairy. You're probably going to need to do that for 3 to 4 weeks and then slowly add it back in. And if you see no difference once you've added it back in, you probably are not going to see a difference. Let's see. We've done that, and we also answered that question. Anyone else? The new drug that was just approved, yep. Deb, you're on mute.
You gave some really wonderful information. That was great. I loved how much interaction we had today.
I did too.
You gave some great questions and you gave some wonderful answers.
Oh, we've got one more. Anonymous. I've been very depressed since my recent diagnosis. Any advice? It's been hard to accept. Depression after a diagnosis is absolutely 100% normal. We have to process what's going on. And people say that we process it in much the same way as we process stage of grief. Now, fortunately, we've got things that can address MS, that can treat MS, which we didn't have back when I first got MS. I'd had MS for at least 19 years before my diagnosis, and there was only one med on the market when I was diagnosed, and it had a lottery for it, so I didn't qualify. There's just so much. This is the best time in the world to get a diagnosis like this. So I would say just sit with that and learn how people are getting through it and coping with it and get onto a medication. And this is going to be in the past, and you're going to wonder how you could be so depressed from it.
Cherie, I'm sorry to interrupt you, but I wanted to just interject for 1 second. The person you were just answering the question to, would you suggest that she go to a support group and get involved in a support group? Would that help her with?
I would say the more stories you can hear of how other people have dealt with this thing, the better. The Multiple Sclerosis Foundation has 3 support groups online that are for the general public, except that they're private. So you can ask questions without your friends seeing them, unless the friends are also members of that group. So it's the Multiple Sclerosis Foundation. It's MS Focus Confidential, and that's only for people living with MS. It's not for family members. It's only for individuals living with MS. It's not for people who've not yet been diagnosed. And then there's an MS Care Partners only, and that's only for individuals who are not living with MS. So yes, thank you. Bridget asks, what is the relationship between transverse myelitis and MS? Transverse myelitis may actually be CIS or clinically isolated syndrome. And oftentimes we see people who are diagnosed with transverse myelitis going on ultimately to be diagnosed with MS. It's not an all the time thing, but I would certainly be a little bit more cautious and a little bit more aware. Thoughts on medical cannabis or CBD? Dr. Ben Thrower has got so many videos on our YouTube channel, the Multiple Sclerosis Foundation YouTube channel, on medical cannabis and CBD that are very, very helpful. He breaks down the different strains and which strains work best for which symptoms and how to appropriately use them so that they're medicinal and not recreational. He really is kind of the person I go to when I need information on it. I would say that you want to tailor it to your symptoms. So, and Dr. Thrower can really help you with that. So the Multiple Sclerosis Foundation YouTube channel, Dr. Ben Thrower, medical cannabis and CBD. And I actually have another meeting that I'm due to be in at 4 o'clock. So that's 3 minutes away. Thank you so much, all of you, for your thoughts and your courage to ask questions. I appreciate you.
Thank you, Cherie. It really does bring us to the end of our time. If you've missed any part of this conference, it has been recorded and will be available through the MS Focus Facebook and YouTube channels. Reply to your registration email for information on how to access recordings or sign up for our newsletter, which is going to help you learn about the upcoming events. Our next teleconference will be, interesting that you mentioned his name, this coming Tuesday, January 10th at 4:30 p.m. And it's going to be MS neurologist Ben Thrower. He's going to be discussing generics versus biosimilars versus bioequivalents and what does it all mean. It's so confusing. So as you leave the conference today, I would encourage you to take the survey that's going to pop up on your screen. We ask you to just take that moment to give us your feedback on the program and also your suggestions for future topics. This way, we're going to really understand what's most meaningful for you, what's going to help you the most so we can get those programs up. Our sincere thanks to all of our attendees for your participation today, and especially to Cherie Binns, who spends so much of her time helping the Multiple Sclerosis Foundation and the MS community. Enjoy the rest of your day, everyone, and we look forward to seeing you next time. Bye, everybody.